I'm Luke Balsamo. I'm an orthopedic surgeon who subspecializes in orthopedic oncology. I work for Atlantic Orthopaedics in Virginia Beach. I've spent many years in the Navy, and then I retired and joined Atlantic to stay locally. Orthopedic oncology is the specialty of orthopedics that takes care of malignant and benign tumors of the skeletal system, including metastatic disease. Medicine always made sense to me, and I really like the ability to help people and get them kind of back on their feet. The orthopedics, particularly, I enjoyed because it was kind of an old to young, head to toe practice, and especially so in orthopedic oncology, where I am dealing with children to adults, and I'm dealing with all parts of the body. So it's very satisfying to take care of these people and get them back up on their feet and improve their quality of life. You get to work hand in hand with medical oncologists. And a lot of the improvements over the last many years has been through the different chemotherapies and immunotherapies that have come around that help people make cancer a chronic disease. And that colors what I do, because I'm going to try then and make a reconstruction something that is never going to fail. It's very fascinating to see how the immunotherapies and the chemotherapies have changed over the years to increase people's survival. There are a lot of kind of interesting things I do, and kind of going back to the old to young, head to toe, I've had pediatric cases where they're benign lesions, but they've caused a lot of pain and prevented function. And I've been able to help those children out. And recently I've had some older adults with metastatic disease to their hips, and they can't walk anymore because of the pain. And I've been able to do reconstructive surgery on them, and it's gotten them out of the wheelchair and walking around. With Atlantic Orthopaedics, I do a lot of my practice at Sentara Hospital. Sentara Hospital is building a cancer center right next to it. So it is very valuable, as I've talked about, the team approach, to have the team all under one roof, quite literally. And that is going to be very helpful for patient care and getting patients through the system as quickly and as efficiently as possible.